Hey everyone, I have Lindsay Midura here, and I'm super excited for her to go over all of her knowledge and expertise. Please, Lindsay, let everyone know who you are and what you do.
Sure. Hi, I'm glad to be here. My name is Lindsay Midura. I am a registered and licensed dietitian, and I specialize in treating people who are healing from eating disorders.
Yeah, can you tell us a little bit more about what you do and what that's like?
Yeah, absolutely. What I do is pretty multifaceted, but I work with helping other people from varying levels of care, all the way from outpatient to intensive outpatient to what we would call a partial hospitalization program. So all levels on the continuum up until residential and inpatient care on their journey towards healing from their eating disorders. I see people with all different types of diagnoses, from anorexia, bulimia, binge eating, orthorexia, ARFID, and OSFED diagnoses. And my day kind of really has a lot of interaction with clients. So it's going to be a lot of one-on-one appointments, going over specialized needs based on whatever we're working on. I make meal plans and then help people execute those meal plans, as well as considering and talking about symptom reduction and utilizing other skills to make sure that they're optimizing their nutrition without obsessing about it or using maladaptive behavior. So yeah, it's kind of what my day looks like. And then as far as within the higher levels of care, I do run different support groups, so meal groups. We do sit and do therapeutic and supportive meals with a group of clients, as well as I do education around nutrition groups every week with clients in those levels of care too.
Wow. How did you get into this type of work?
Oh gosh. So I think that journey started for me quite a while back. In my early 20s, I was dealing with my own mental health and then struggling with digestive issues as well. And I just was trying to find solutions and felt perpetually invalidated by the allopathic medical community, and doctors were so often trying to treat symptoms instead of getting to the root cause. And so it was really discouraging, and I felt really like I was processed through a system instead of being considered as a complex human being. And so I started doing my own research and implementing my own nutrition, and that really made such a drastic difference in my well-being, both mentally and physically, that I was very set from that point on trying to figure out a way that I could empower others to take care of themselves. I think you kind of have a similar path in that way.
Yeah.
And just through everyday choices, and while also felt very strongly like I wanted to advocate for validating other people's health, challenges with health and the medical industrial complex, like I like to call it. And so I started my degree in nutrition. And while I was in my studies at the University of Minnesota, I caught word of someone by the name of Lisa Deers, and she was at that time the national director of nutrition and yoga at the Emily program. And I was like, oh, wow, she merged my two passions. How did she do that? I really need to meet this woman. Because I, as you know, Cece, but maybe people don't know that I've taught yoga for several years prior to pursuing nutrition. And so I tried to figure out a way to meet her, and it was very serendipitous, or I guess I would just say a lot of series of events led what felt like a very divine events ended up to me working with her very shortly after that as a yoga instructor. And then now she's a very close mentor and friend, even though she has her own private practice now instead of working at Emily program. And so once I was there, everything really felt in sync, and I very much felt a sense of that this is the work I wanted to be doing and was meant to be doing. And I really developed a deep respect for individuals who were working so hard to like do this challenging work of learning to understand our bodies and our minds, and a really keen awareness to the complexities of our relationship to food and our own bodies. And so then I just became more and more very intentional in my steps, kind of pigeonholing down this specialty path of wanting to do my internship through the Emily program in coordination with the University of Minnesota to become a dietitian there. So I did my clinical practice there in coordination with my alma mater, and I guess the rest is history. Once I finished my clinical practice and got boards, and passed my boards, I actually got offered a position right away, and I've been working there ever since. And it gives me life. It's given me such a deeper perspective to nutrition, and it really becomes a lot deeper than the nutrient profile of foods or a diet, and more understanding people's stories and intersectionalities and what they've been through that's crafted their relationship to food and themselves. And so I just really love I feel very privileged being able to help people down that path of one of healing and a life worth living. It's a pretty amazing journey to witness. There's being able to witness people's stories and walk with them is, it's beyond words awesome. So
wow.
That's great. Long story, but
no, that's okay. It's so great. And I, with you and with another nutritionist at my office, I'm really understanding the emotions behind food and relationships with food and the cultural aspects with food, and not just seeing the nutrient side of food, which I have for so long, and really trying to help people understand their connection to food and how it might be a connection to memories in their childhood or to patterns that they've done their whole life. And so those things need to be understood rather than just saying, you need to get rid of this food. That food might give them comfort or a sense of relief that they've always had. So I totally respect what you do. And I'd love to learn a little bit more about where you think disordered eating comes from.
Yeah, I think
I'm sure it's a very broad and complex topic, and I know everyone's individual, but I'm just curious with your practice and what you've seen so far.
Yeah, I definitely think you kind of hit it on the head there. There's obviously a different path of how somebody does develop an eating disorder over time, and everyone is very different, but there are a few different avenues that we know from evidence where they could stem from. One of them is that some eating disorders may be inherent from birth or a young age due to like neurological and hormonal conditions that can lead to various sensory issues. We also know very much from research, kind of also what you mentioned, that westernized media breeds eating disorders, and that based on the types of bodies we see in the media and messages of worthiness attached to our image and diets being marketed, that it can be very problematic. So while not everyone's eating disorder stems from that, almost everyone it's impacted them negatively in some way. And we also know that eating disorders, I guess, in a subsect of the westernized diet is very much in line with the family system, kind of, and that while that is impacted by what we have in our culture and maybe what our parents raised us around and what they knew, it also then kind of speaks to generational trauma and trauma in general. So we know that eating disorders can start as a tool to cope with challenging emotions or trauma, and eating disorders serve as a way to distract or to numb or to soothe emotions in many cases. So that's also another thing to be considered is how the eating disorder has served as a tool that's been effective in managing trauma in part, and then while often knowing that it does become maladaptive and more harmful over time. So, and then there's also the possibility and, prevalence that for many, it could be a combination of any of those things.
Right, right. And what would you say, based off of those facts, how do people work on regulating their emotions and healing from trauma that you're dealing with? And also kind of helping them let go of that society's image of what the body should look like. How do you work with people on these different areas?
Well, while it very much overlaps with my nutrition degree within this line of work, there's not a way to talk about the food with eating disorders without somehow coming back to the root causes or some of the distorted thinking or various other symptoms of eating disorder. We also work very closely in line with therapists who take on the bulk of the work in terms of treating the trauma that is coming up and treating therapeutically some of the distorted thinking, the catastrophic thoughts, the dysregulated emotions. And so while a lot of that is something that I've learned to hone in on in my practice, I do want to note that is not my specialty, and that I'm very privileged to work with some awesome therapists. And so in terms of healing from that work, it really does come down to pairing that nutrition work along with a therapist. Working with the Emily program, in order to see a dietitian, you have to simultaneously see a therapist, and so that we're working in tandem through that journey, knowing that it's more complex than just the food. And there might be a variety of different approaches that the therapist can take, from a trauma practice in terms of cognitive behavioral therapy, or bringing the family on board, or dialectical behavior therapy. So there's a lot of different means. And then a lot of our program for our patients in higher levels of care also doing a mindfulness-based practice and a mind-body yoga practice every day as well. So it's really like a very gradual experience between like slowly learning to reconnect to our bodies while managing the distress that comes up when people with these eating disorders are starting to reconnect to their bodies for the first time in ages. And then sometimes the way that my nutrition degree can come in intact, or into that picture, I guess what a better way to say it is, that using that science base to check the facts around some of the disordered thinking around food rules and rituals and rigid thinking, or catastrophic thinking around foods, to really just provide some grounding and some scientific evidence and support along the way, so that they're nourishing themselves as adequately and best as possible while doing that deeper emotional work.
I love that. I love that your program combines the two. It's so essential.
Very.
And you have mentioned, catastrophic thoughts twice. And for the viewer, they might not know what those are. Can you explain what that means?
Yeah, so it could mean something like all or nothing or black and white thinking. Like, if I eat this dessert, it's going to absolutely change my body, which will mean that I am worthless, which will mean people will see me as less than or as ugly. It could really go down a lot of different roads, but it's that distortion where something that would, for a healthy individual, be perceived as like a normal part of a daily meal, as having something sweet on the side, perhaps. And then it creating such distress to see that thing or to try to implement it, that it is causing all types of systemic stress, like cortisol increasing and fight and flight stimulated, and lots of different ways of thinking that can feel really dark and very hopeless. So we really try to reel some of that back through different grounding techniques and through group support.
Got it. Can you explain what some of those grounding techniques are?
Yeah, absolutely. So a lot of times it just comes back to the breath. It does depend on the situation, but oftentimes when someone's dysregulated, we're going to offer them to step back to the breath and the present moment, because these catastrophic thoughts either often exist based on ties to experiences in our past or fears of the future. And so honing in on grounding in the moment is really what's going to provide a sense of safety, feelings of safety in the body, even if it takes a bit of time for the mind to catch on. So often at times it's starting with diaphragmatic breathing, and noticing the breath and the qualities of the breath. It might mean something like doing a sensory guided meditation of drawing in the senses of smell, of sight, of hearing and sound, of touch, of temperature, just to become more centered within the body. And oftentimes one of my favorites is just grounding and connecting to the floor with our feet. Just pushing into the floor, feeling that grounded support of the earth. And also knowing that people that suffer from trauma or PTSD, it might be really hard for them to have sensory awareness in their bodies. And so oftentimes going to more neutral spots like the fingertips or the feet can be a great place to start in addition to the breath.
Great. Thank you so much. I love that you mentioned all that stuff. I use all of that in my practice, and I just think it's so beneficial to do somatic or grounding work to really help people create and develop that connection and make them feel safe in their body after maybe not feeling safe for so long.
Yeah, it's a very tricky, and it's a titrating process. So we start really simple because it's an exposure. Sometimes it takes exposure to our own bodies. And if we feel everything at once, it can make us shut down or feel very panicked. So, and when I say us, I'm talking about clients, but I use that terminology a lot. And so that gradated exposure we'll take with connection to the body, just like we will with food, with gradual exposure to different kinds of food and types of food, or situations with food, to help people feel more freedom overall around themselves and their bodies with food and nourishing themselves.
Can you explain maybe one or two things that you do when you do exposure to food?
Yeah, I think it is very individualized based on clients, but for instance, I had a client yesterday who challenged cheesecake for the first time in like 8 years. It's been her favorite food. She had it every year on her birthday and has become so distressed by it that even going to pick it out in the store, she's left several times. And she said, even just a month or two ago, I told myself, I saw that in the store and I remembered all my associations to it and thought, well, that's too bad. I'm never going to have that again for the rest of my whole life. And so that's, again, some of that catastrophic or black and white thinking of like that nothingness. I cannot have this. And so yesterday she brought that in, and this is somebody that's been doing really, really great, very recovery oriented, very motivated work around her eating disorder, and was able to eat that along with support and encouragement and checking the facts around like, yes, these things, there are these components or these qualities of the food, but they do meet your meal plan, and this isn't going to change your body drastically after one meal, and doing some breathing. And then part of that exposure is knowing that she knew that she was going to feel dysregulated from it and have really loud thoughts or eating disorder thoughts, being very angry about what she did. And so sitting with some of those, what we call urges or urge surfing, and just allowing ourselves to sit in acceptance that I'm experiencing a distressing emotion and I'm okay. And so that's just one example, but it really does depend on what people's various relationships are with food, that we can customize those challenges to different degrees based on what they're ready for.
Wow, that's great. Yeah, that was a really good example. Thank you. And then any recommendations or techniques for someone watching this at home that maybe has disordered eating or knows someone who has disordered eating who might be really having a tough time right now with staying at home?
Yeah, absolutely. I think this is such a sensitive time for everyone. And then it's such added sensitivity when we are dealing with any mental health conditions, including eating disorders. So I just want to validate how real that struggle is, while also, like you said, naming some of the tips or some of the supports that are out there. And so one of the main tips that I like to recommend is just to continue to encourage people to connect with your treatment team, to connect with your family, to connect with your friends. I know it's not ideal navigating circumstances of recovering from the eating disorder during a pandemic, but in terms of resources, they are very much out there. People are really wanting to help. And we also know that eating disorders thrive in isolation. So what I would recommend primarily is to keep what those struggles are out in the open with your treatment team, and also with your trusted peers. It might not be everyone, but are there one or two or three people that you can share these experiences with and what's going on, to keep some of the symptoms or the thoughts in the light, knowing that those eating disorder thoughts thrive in that secrecy and darkness and isolation.
Okay.
I would say one, of course, from a nutrition standpoint, is to follow your meal plan. And so whatever tools you need to do so, maybe it's setting reminders in your phone to remind you to eat. Maybe it's prepping or planning meals ahead of time, or making a grocery list ahead of time, so that when you do go to the store, you commit to those items, to get those items on your meal plan. It might be scheduling a FaceTime call or something with a friend to have accountability for a meal or a snack. Or it might be just distracting while sitting down with your food. If you're feeling really distressed during meals, with a Netflix show or a puzzle, or even like journaling. And then after the meal, or with some of those distressful thoughts, maybe spending some time before or after, or even during, doing some grounding techniques. So maybe it's some gentle breaths, or some gentle yoga afterwards, or getting some warm tea or a cozy blanket, or journaling about your experience. And if there is anyone out there that is not sure what they should be eating, I'm happy if they want to reach out to me to put them in touch with any resources that might be available in their area or virtually.
Yeah, that's great. Can you please let everyone know your either email or Instagram, however they can contact you?
Yeah, absolutely. So my Instagram is the.yogi.dietitian. So the Yogi Dietitian. And I do respond to any direct messages on there as well. My website is lindsaymidura.com, and there is a way to send me direct emails through my website. And it'll also just talk a little bit more about what I do on that as well. So those are the best ways to connect with me.
Great. Thank you. And then any organizations that you recommend?
Yeah, definitely. Organizations. So the National Eating Disorder Association is a great resource. Their online resources are pretty comprehensive in terms of blog posts and articles and research, as well as community-based organized events, even though those aren't happening currently, but they are staying active during COVID and everything in the social media platform. of course, the Emily program, have to plug that because
Yeah.
we do keep up to date with our blog posts and on social media, Instagram.
Great.
Project Heal is another one that I really like as well. There's a lot of local cohorts, even though it is national, that have community organizers to try to advocate for people struggling with disordered eating, different events. I attended a yoga outdoor event last summer, hoping, I don't know if it's going to happen this summer. I think they closed the parks, but just checking out their website and seeing how they are offering different resources and encouragement. Those are the three that come to mind.
Okay, great. And then regarding, because I've worked with a few people with binge eating. Binge eating is kind of a big one. Do you have any specific tips for someone who binge eats?
Yeah, I definitely think the more specific tips would be as I got to know you more one-on-one, that could be even more specific. But some of the things that come to mind in terms of like more general ways to manage binge eating. So when those urges are occurring, or we're in the middle of a cycle of binging, allowing yourself or giving yourself some sort of interrupter or permission to step outside or to step outside of the area or place that ritual usually occurs. So it might be that this ritual commonly happens in your bedroom or in front of the TV. So when there is some awareness built around, oh, I realize this is happening and I'm going into this place of binging, trying to put a pause on it. I don't say like necessarily, does that mean you should stop eating? Maybe not, but just giving yourself a pause and to maybe step outside. Outside is a great one because I really think that some of the senses that come about when we're outside can become more activated in a calming way. So taking some breaths, maybe doing a short meditation, just noticing your body, maybe even then seeing if you can have any awareness of your body, and knowing that it takes time for our body's hunger and fullness cues to kind of send messages to our brain. That pause might be the pause you need to really know, am I still feeling hungry, or is it emotional hunger? Can I notice fullness? So that pause can kind of bring our brain and our mind back into sync. And then after that 5 minutes, know that you can return to eating if it still feels helpful. Another thing that I like to ask clients to be curious about is it emotional hunger or physical hunger? And if it is feeling more emotional, asking, what am I emotionally hungry for? And then try to spend some time being curious with yourself, through journaling, or with your provider, whether that's a therapist or dietitian or doctor, some non-food related ways that you could soothe and take care of that emotion. And then, of course, following your meal plan. I think that's something that I can preach till the cows come home. That we know that scientifically, research driven, that restriction during the day often leads to binging. So in order to break that cycle, following those consistent eating times during the day and throughout the day are going to be very protective in reducing those urges.
Great. Thank you so much.
Absolutely.
I really appreciate you taking some time. I'm sure whoever is watching this, if they suffer from it or know someone they suffer from, with disordered eating, they definitely are going to share it because you really gave some wonderful wisdom. Any last thoughts?
Yeah, I would like to. There is one Instagram account that has kind of been birthed through the COVID crisis, and it's called COVID-19 Eating Support on Instagram, and they offer 24 hours. So once every hour there is a eating disorder professional, whether it is a therapist or a dietitian, there are some nurses and other various professions, but primarily therapists and dietitians showing up on there on an hourly basis just to provide a place of support to build community. And then there's like a live chat going on, so you can ask questions of that professional and ask for support. So if you're really finding that it's challenging to meet your meal plan or navigate urges or symptoms, I would just log on to there as like a starting point, knowing that it's a no judgment, very supportive environment. And then also, if for any reason you're having trouble managing symptoms on your own, again, feeling free to reach out to me. Even if it's not working with me directly, I'm happy to put you in touch with resources in your area, or resources that are most suitable for you.
Great. Thank you so much, Lindsay.
My pleasure.
Yeah. I'm excited to upload this and share with everyone. I hope you have a wonderful rest of your day, and I will talk to you soon.
Sounds good. Thanks so much.
Yeah.
You too.
Bye-bye.